You're running a medical practice and you're asking yourself the same questions every healthcare provider asks. How do I reduce costs without sacrificing quality? How do I free up my in-house team? And how do I stop spending so much time on administrative work that I can't focus on patient care? Let me answer the questions you're probably already thinking about virtual medical staffing. First question: what exactly is virtual medical staffing? Virtual medical staffing means bringing trained healthcare professionals onto your team who work remotely instead of in your office. These aren't general virtual assistants. They're specialists trained in medical terminology, HIPAA compliance, EHR systems, and healthcare workflows. They handle administrative and clinical support tasks that don't require physical presence: scheduling, insurance verification, billing, documentation, patient follow-ups, and telehealth coordination. Next question: is it actually secure? What about HIPAA compliance? This is the number one concern, and rightfully so. Reputable virtual medical staffing providers operate under strict HIPAA protocols. Their staff work in secure, encrypted environments, complete mandatory HIPAA training, and sign business associate agreements. All communication happens through encrypted channels, and access to patient data is role-based and monitored. You're not sacrificing security. You're working with professionals who take compliance as seriously as you do. Okay, so what can virtual staff actually do for my practice? Think about everything that takes your team away from patients. Virtual staff handle appointment scheduling and reminders, reducing no-shows by 25 to 35%. They verify insurance eligibility and process prior authorizations, cutting down claim denials. They manage medical billing and coding, speeding up your revenue cycle by 15 to 25%. They update electronic health record systems, respond to patient portal messages, conduct follow-up calls, and even support telehealth sessions with patient onboarding and technical troubleshooting. Essentially, if it doesn't require hands-on patient interaction, virtual staff can handle it. Here's the big question: how much does it really cost? An in-house medical assistant costs you $40,000 to $50,000 in salary, plus another $15,000 to $20,000 in benefits, taxes, and overhead. You're looking at $60,000 to $70,000 annually per position. A full-time virtual medical assistant costs between $3,000 and $4,500 per month. That's $36,000 to $54,000 per year, fully loaded. No benefits, no office space, no equipment. That's 40 to 50% savings for the same level of support. And if you only need part-time help, you can scale down to $1,500 to $2,500 monthly. What about integration? Will they work with our EHR system? Professional virtual medical staff are trained on the major EHR platforms: Epic, Cerner, Athena Health, NextGen, eClinicalWorks, Cario. During onboarding, they receive focused training on your specific system and workflows. Most practices see productive output within 2 weeks and full proficiency by week 4. They integrate into your existing setup. You don't change systems to accommodate them. How do we train them? Don't we have to start from scratch? Number: virtual medical staff come pre-trained in healthcare administration fundamentals. Your job is to onboard them to your practice-specific protocols, your communication style, your patient demographics, your insurance panels, your preferred workflows. Most providers assign a dedicated account manager during onboarding to facilitate this process. You're not building from zero. You're customizing professionals who already know healthcare. What about quality control? How do I know they're doing the job right? That's where accountability comes in. Reputable staffing providers monitor performance through key metrics: task completion rates, accuracy scores, response times, and patient satisfaction impact. You have access to reporting dashboards, and most providers conduct regular performance reviews. If someone isn't meeting standards, they're replaced or retrained. You're not managing blind. You have oversight. Can I scale up or down as needed? Absolutely. That's one of the biggest advantages. Need extra coverage during flu season? Add a virtual assistant for 3 months? Opening a new location? Deploy trained staff immediately without a lengthy hiring process. Patient volume drops? Scale back hours without layoffs or severance. Virtual staffing is flexible in a way traditional hiring never can be. What kind of ROI are practices actually seeing? Let's get specific. A 3-provider primary care practice invests $7,000 monthly for 2 full-time virtual assistants. They see an extra 2 patients per provider daily, generating $18,000 in additional monthly revenue. Reduced claim denials add another $1,250 monthly. Eliminated overtime saves $2,400. Fewer no-shows recover $1,800. That's $23,450 in monthly returns on a $7,000 investment, a 235% ROI. Most practices hit full ROI within 30 to 60 days. Last question, how do we get started? Start by identifying your biggest bottlenecks. Is it scheduling, billing, insurance verification? Choose 1 or 2 areas to delegate first, rather than trying to overhaul everything at once. Research providers with healthcare-specific experience, verify their HIPAA compliance, and check their client references. Request demonstrations and speak to practices similar to yours. Once you select a provider, document your workflows, establish clear protocols, and invest in thorough onboarding during the first 2 to 4 weeks. Here's the reality. Virtual medical staffing isn't about replacing your team. It's about multiplying their effectiveness. Your in-house staff focuses on direct patient care and clinical responsibilities. Your virtual staff handles the time-consuming back-office work that keeps the practice running. Together, they create a more efficient, less stressed, and more profitable practice. The practices thriving today aren't working harder. They're working smarter by leveraging remote healthcare professionals who deliver expert support without the overhead burden. If you're spending over $60,000 per administrative position, dealing with staffing shortages, or watching your providers burn out from paperwork, virtual medical staffing isn't just an option anymore, it's a strategic necessity.